All right, welcome to the Ivy League, where we're going to get into some of today's hottest health topics with some of healthcare's finest, and today is no exception. We have Dr. Shayla Moore. Welcome.
Thank you.
Of course. So, first of all, when was the last time we saw each other?
We saw each other in 2014 at an NPC show, backstage.
Backstage. I had no idea you was doing a show.
Likewise.
I was like, I know her. I was like, oh, hey. So that was like, what was that, like 8 years ago?
Yeah.
Wow. And I seen you transition from, I think, when I met you, you were about to go to nursing school.
Mm-hmm.
Now you were pro in the game right now.
I don't know about that, but I'm trying. I've definitely grown a lot. Yeah. So when you met me, I was literally working as a CNA, a nursing assistant.
Wow.
And that's what actually pushed me into going to nursing, because I was like, let me just kind of dibble and dabble in that first before I jump right into school. So once I did that, I took care of a 93-year-old lady at the time, had Parkinson's. She was my only patient. I drove out to Cumming 4 days a week.
Wow.
From Smyrna. Yeah, good 45-minute drive.
Smyrna.
Yes. I loved her so much. And then, so from there, I just knew I wanted to go to school. And so when you met me, I was in the training mode, but when school started, I was like, okay, I probably cannot, keep up meal prepping and training. How it is. Like, that's a full-time job.
They don't talk about the outskirts, the external factors of nursing school. Like, that's wild. So, not to get off tangent. So, I met you. I know a lot of people were CNAs or LPNs. And I was like, man, they had a leg up on me. I was in finance. Like, I just took a whole different route. But anyway, what are you doing now? What kind of nursing do you do?
Yeah, so now I went back to school, decided to do nurse practitioner. I always knew I wanted to be a nurse practitioner.
Okay.
But I wanted to get my feet wet on the floor as an RN, cardiac thoracic step down unit, actually is my background. And then from there, went into nursing school, nurse practitioner school, decided to do the BSN to DNP program, which is receiving your MSN and your doctorate.
You're going for it all.
Yeah, I was like, if I'm going back to school, let me just knock it all out.
I ain't mad.
So I ended up getting certified in family nurse practitioner, which is very broad. That's why I chose that area.
Got you.
First job was at a student health clinic, part-time. It wasn't going to be a permanent thing. I knew that because it was part-time, but it was primary care. And then COVID hit 2020. So that turned into me swabbing COVID tests all the time. And then from there, I ended up landing into women's health / interventional radiology, which is where fibroids came about.
So let's talk about that.
Yeah.
So that's one of the main issues I want to talk about with you, because you're a activist for fibroids. What got you into that? And explain to people, because when I heard about fibroids, I'm like, I'm a guy, I don't know what that really is. But I know that a lot of women, I don't know if suffer is the right word, but suffer from fibroids. So can you explain what that is exactly?
Yes. So to answer the first question, so I was diagnosed with fibroids back in 2016. It was like my last year of nursing school, BSN.
Okay.
And of course, you're stressing about worrying about finals and stuff. The last thing you want to be thinking about is your health. So when I was diagnosed with one small one, I was like, whatever, I'm gonna get to that later. Like, I don't have time for that. I don't have time for that. But
that's
basically,
how it is in school. You deal with that later.
You push everything to the side, and then you graduate. It's like, dang, I'm falling apart. But no, fibroids are non-cancerous tumors or growths that grow in the uterine muscle. And depending on where they grow, they can cause symptoms where a woman will suffer. So they're non-cancerous, which is great. They're benign. So they, most times if they don't bother you, we say don't bother them. Unfortunately, depending on the area, the size that they grow, they can cause symptoms. So those symptoms could be heavy bleeding, menstrual cramp, pain, back pain, constipation, urinary frequency, anemia, leg pain. I mean, the list goes on.
List. And it's all depending on where the fibroid is.
Where the fibroid is, how big it's growing, what organs are near that it's pushing on. So if it's a big fibroid sitting on top of your bladder, urinary frequency. If it's pushing towards the back of the uterus, back pain, constipation. If it's hitting the cervix, sexual intercourse pain.
Wow.
So yeah, the list goes on. And then bloating, and then actually having a stomach that's growing and making yourself look pregnant. So you have that aesthetic impact as well.
Right. Which obviously can affect your
mental health. God, yes.
Wow.
Yes.
So speak about the mental health part. So when you were diagnosed with it, what were your thoughts initially? Besides, it was small, so I'll deal with it later, right?
Right. Well, the first thing I did was call my mom, like we always do, because I knew that my mom had suffered from fibroids. She didn't really talk about it a lot growing up. Maybe she didn't think I would have to even deal with this.
Right.
But once I got diagnosed, I called her and she's like, oh, I was hoping you weren't going to get this. I have fibroids, and growing up, I've seen her being sick and things like that.
Did you know she had it at that time?
Yes.
Oh, so you knew she had it?
Yeah, but she never talked about it.
Okay.
Like,
okay.
Yeah. We never got into detail about what it is, why.
She was hoping it would just.
Yeah, it would skip me.
Yeah.
Mm-hmm. So when I told her, she's like, don't worry, it'll be fine. Then fast forward, like, swear that thing grew from probably the size of a plum to a grapefruit.
I mean, it started as a plum. I mean, that's
Yes.
already okay.
So within about like 6 months, that thing had, I'm telling you, I have photos. Huge.
Oh my God.
And my stomach just,
The symptoms obviously changed.
Yeah, so I started having pain.
Okay.
That was my main thing. And urinary frequency, because it was a big one towards the front on the bladder.
So you just constantly going to the bathroom. Like
yes. And then just pain, just radiating pain. Mm-hmm.
So what'd you do? So was this, you're still in nursing school with this?
Yeah.
Okay. So, I mean, sheesh. All right.
Yeah.
So what did you do with that?
Okay. So once I graduated, got my first job.
Mm-hmm.
So during that time at my first job, I think my stress was high, and that thing grows with stress and estrogen. So anyway, it grew and grew and grew. So I'm telling you, I was out of my job starting January through February. I was out like 8 weeks. I had just started at Piedmont in July, got the surgery in January, then I was out for 8 weeks.
So you had the surgery.
I had the surgery.
Out. So why were you out? It got better, right?
Well, so the surgery is very intensive. So it's called an abdominal myomectomy, an open myomectomy, where they literally cut you across like a C-section.
Wow.
Same as that kind of thing.
Okay.
Instead of delivering a baby, you're delivering a fibroid. So all those layers that you're getting cut through, the recovery time, you can't lift, you can't
really move without,
pain. Yeah.
Wow. So 8 weeks. Okay. Wow. So that is what got you into fibroids.
Yeah. Yeah. I mean, and then just the job, when I started working as a provider for a practice that treats fibroids, it was like my ultimate passion.
Okay.
This is like perfect. Oh my gosh. So that's what led me into that.
So what are some misconceptions about it?
I think the biggest thing is women don't really talk about it. Like I said, my mom didn't share.
Yeah.
Grandma probably didn't know. She did have. And back then they just took the whole uterus out. And people are ashamed. Women are just ashamed, embarrassed of having this issue, especially when you can't have a child because of fibroids.
Fertility issues.
Yeah.
Now, with the fertility issue, I know somebody who had issues with fibroids and they were worried about pregnancy later on down the line. Mm-hmm. So how does that really affect it? Is it 50% of women it affects, or it just depends on where it is?
Exactly what you just said.
Depends on where
it is. So again, if you have fibroids that don't cause any symptoms or any issues with fertility, you leave them alone. You can have a healthy baby with fibroids. They literally just get moved out the way. The uterus grows with the baby and the fibroids kind of grow too. But depending on location. Okay. So if you have fibroids that are growing in the cavity, which is also where the baby is growing, that's when it becomes an issue. So you have, I forget the term, but low birth growth. Uterine, I forget.
It's okay.
So the baby can't grow properly. The baby's not getting nutrients. So unfortunately, it may end up in a miscarriage.
So if a person goes to the doctor, can the doctor say, hey, it's only this small and it's okay to get pregnant and have a baby, or what's the risk factor?
Yeah, it's hard to say.
It's hard to say, right? It's not a cut and define, right?
No, it's not. No. Typically, they'll try to let you just go on with your pregnancy, and if it ends in a miscarriage, then you'll talk about surgery or interventions. But
that's hard to go through that first and then find out and then have to go through it again and then going back to the mental aspect.
Yes.
Okay. Wow.
Yes.
And so going on the mental aspect, I watched the show you were on with Fibroids Brunch.
Yeah.
I watched that, and you mentioned how you were talking to your husband, he was like, I have one good week out the month. Mm-hmm. Is that normal? Because when you broke it down, it makes sense, but it was it must be tough to deal with, but you learn to live with it. I guess let me know.
Yes, so definitely that's an honest answer, and he'll tell you too. Because what I mentioned earlier, all the symptoms, if you have heavy bleeding, you're going to be anemic, and anemia leads to fatigue, irritability, low sex drive. That's going to impact you overall. Yeah. And so as it takes a couple of weeks or so to get your blood levels back up again, the one time it actually kind of peaks a little bit, it's oh, okay, I have a little bit of energy. And the next thing you know, the period's back on again. So you can never catch up. It's just this constant up and down, up and down, up and down.
Got you.
So definitely having a supportive partner to walk through this with you, not get upset with you. And
that's awesome. That's understanding, right? Rocket, listen, I'm here for it.
Yes.
So I did want to touch on, because I know there's like biases with Black women when it comes to like pain, and when they go to the doctor, may not believe them, right? Like I remember a young lady in Carrot Johnson in California who died hours after birth.
Yes.
And her husband were telling the doc, hey, listen, she's bleeding, this and that. And that was just heartbreaking, right? And so what would you tell any woman, honestly, to navigate through that bias that healthcare professionals may have, unfortunately?
That's a very unfortunate thing. And it happens to friends of mine.
Really?
I've had friends, yes. I've had a friend who's actually a nurse practitioner, mental health nurse practitioner that had to go through this. I had another friend that was in the hospital and ended up having to get a C-section. So, yeah, so it happens, unfortunately. And I would just say, the bias in terms of Black people in general not having pain. I've gone through, I've had a list of surgeries for fibroids, but my most recent one, and which actually was about 2 weeks ago.
So this is an ongoing thing, the surgeries?
Unfortunately.
So is it because it continues to grow?
Yeah. So here's the thing. Once you have the genetic history of fibroids, you can do certain things like lifestyle changes to prevent them from either one, getting bigger, or two, just kind of managing your symptoms. But at some point, it's just not enough.
Gotcha.
So, yeah. So, unfortunately, in my case, I have certain ones that are growing, but they shouldn't be growing, and they're impacting me.
Okay.
So, I've had a handful of surgeries. Okay. But anyway, to speak to that, when it was done, it was a simple procedure per se, but it still involves a little bit of pain, right?
Of course.
Everything has pain. Right. So as I'm being discharged, it's like, all right, here's your discharge instructions. The nurse is going over it with me. And on the side, it was like, take OTC pain medications. And I'm not a person that likes to take opioids or narcotics because they make me sick. I actually hate them. But the fact that that wasn't even an option, not even a tramadol or like OTC pain medications. That's it. Ibuprofen.
For
go
surgery.
home.
That's it? Wow.
Yeah.
Okay.
Yes. So you can imagine a woman going through labor or hemorrhaging and being, concerned, and the doctor's not listening to them because they're thinking that they're being overreactive.
Right.
It leads, unfortunately, into a high mortality rate, maternal mortality rate. But I would say my takeaway is advocate for yourself. If you're not educated on the terminology the doctor is speaking or nurse is speaking, reach out to your family, your friends, anybody you know that maybe that's in the medical field.
Right.
And don't take no for an answer. Like, this is your body, this is your child.
I like that. Don't take no for an answer.
Do not take no for an answer.
And if you have medical friends, use them.
Use them. They call me all the time.
Right.
Every day. My dad just texted me. He probably asking me about something medical.
Right. Have you ever had, when you were in nursing school, they thought you were already a nurse?
Yes.
And they were like, hey, what's wrong with me?
Yes, I have no idea.
I don't know what's
No,
wrong
Jazz,
with
I had a cousin, an older cousin, that sent me the results of his colonoscopy. And he was like, how bad do you think this is? I'm like, first of all, like, that's not my area. Follow up with your doctor. That's my go-to. So when they do that, be like, okay, this is what I think, but follow up with your doctor.
Okay.
Follow up with your provider.
Yeah. Come to me.
Don't be using my name like Jazz said,
No, never that. So if somebody wants to learn more about fibroids and just haven't had anybody to reach out to, where can they go?
There's lots of resources online in terms of articles if you're kind of into that thing. Okay. But if you want to follow my dear friend, her name is Latoya. She has an Instagram page, which is where you saw the Fibroid Brunch. Okay. It's actually called the Fibroid Pandemic.
Gotcha.
Is the name of her Instagram page. She's huge about posting things.
I'll put that on there so they can follow that as well.
Yeah. I definitely highly recommend her. There's another one on Instagram called Fibroid Queen.
Oh, wow.
That's another page. Her name is Phyllis.
Fibroid Queen.
Shares a lot of information.
Okay.
So yeah, there's lots and lots of resources online. And then you can follow me. I'm kind of building up my Instagram page to do better with educating folks.
I like that, yeah.
So Dr. Shayla Weaver on Instagram. I'll be posting more, but
Yeah. What you got up there is good.
Yeah.
Keep posting that.
Thank you.
All right. So I want to transition to what type of nursing you're doing now. You're doing aesthetic nursing, correct?
Yes, I am.
So, there's a lot of misconception about aesthetic nursing.
Yes.
Please tell me what it is, what you do right now.
Sure. So currently working as an injector and nurse practitioner at an aesthetic practice, a med spa. Okay. The services that I provide or are trained in or certified in include neurotoxin. The brand that we use is Botox. So Botox is a neuromodulator, basically relaxes muscles in areas treated to prevent deep lines, wrinkles from forming.
Gotcha.
In a short kind of way of explaining that. Okay. And then filler, on the other hand, is literally hyaluronic acid our bodies produces. As we age and mature, we start to lose that volume. Things kind of shift around. And so filler is just a treatment for that too.
So do people get like both?
Oh, yeah.
All the time? Yeah? Okay. Wow.
Yes. And men and women come in for those.
I'm about to say I'm going to have to go there.
Yeah. No. I did my brother a couple weeks ago.
Really? You got that family discount.
Yes, for free.
What? I'm going to take that out.
Yeah, you can be my model next time I do a training or something. I'll let you know.
Threaten me with a good time.
Yeah, Botox. Yeah, Botox. It's not just for women.
Obviously, I'm going to say, do you recommend it?
Yeah.
Okay, obviously, right?
Yeah, I actually... honestly, look down upon aesthetics, honestly, before I got into this. I'm thinking like...
I know a lot of people do. That's why I want to have you on as well, because I'm like, it's actually beneficial, right? So, I mean, but it's also just not injected. What else do aesthetic nursing could do as well?
Okay, so yeah, there's other... I mean, me primarily, that's what I do, but I mean, there's a lot of other things. There can be microneedling, which helps build collagen.
Heard about that.
Yeah, it's a list of
and I know it's you are aesthetic is also involved in kind of surgeries, certain kind of surgeries, I think. But so it's a list of things. It's just not injecting chemicals, like, because I thought that as well until I did my research. I'm like, oh, they actually do a good amount of stuff.
So the way our office is set up is that the nurse practitioners and injectors only do injections because it's medication. Botox and filler are medications. And then we also have estheticians that are certified in like the facials, laser hair removal, microneedling, chemical pills, cool sculpting. The list goes on. So they have a lot more services to provide. But nurse practitioners can also be trained in those areas too. But my company focuses mainly on filler, Botox, because it's the moneymaker.
It's the moneymaker. So I mean, what's the percentage between men and women?
Oh, good question.
Yeah, because we are in Atlanta, so you know.
I would say I see probably 96% women, 4% men.
Okay.
And they're all different backgrounds.
Okay.
Black, white, straight, Latino, doesn't matter. So
what about age?
Age, I would say on average 24 to late fit, like 55 on average. And every now and then you'll get some outliers, but
outliers. Okay. So, and we were talking earlier off camera about the number of patients you see a day, and I was like surprised. So, can you explain that? Because I'm like, you may see maybe 8, 7. So
that's what I thought too when I first got hired. I was like, oh, it's gonna be a cool job. I can just chill.
Oh, they bait and switched you.
I was like, dang. So on an average day, I come in at 9 a.m. I have a lunch break at 1:30, go back to work at 2:30, and I leave at 7. So starting at 9 a.m., that's the first appointment, and every 30 minutes is availability for a Botox appointment. Okay. And then for filler, it could be every 45 minutes, and then for a follow-up, it can be 15 minutes. So typically from 9 to 1:30, I'll see maybe like 9 patients. If it's all Botox, like every 30 minutes. And then from 2:30 to 7, I'll see maybe another, 6 patients. So
you need at 7:30, that's crazy.
7, yeah.
That's crazy.
Well, no, our last one we see is at 6:30 or 6, and then we stop at 7. So I'm out of there.
You're out of it? So is it like 5 days a week?
I do 4 days. They're 10-hour days. So I do Tuesday, Wednesday, Thursday, Friday. I used to be on Saturdays. Recently came off of Saturdays. Thank God. This is why I can be here today.
Strategic.
Yes. I had to work my way up. But yeah, 4 days a week. You're on your feet a lot. I mean, it's a long day. But it's fun.
I mean, you said it. You enjoy what you're doing. Do you think you see yourself getting out of it?
At this point, no.
No? Okay.
No, because I'm the person that, like, even like with fibroids, like I do that on the side in terms of like speaking engagements. Of course. Panel, I can still dibble and dabble on that. I'm that person that once I figure out something I'm passionate about, I want to go hard. I want to learn all about it. I want to perfect it.
Expert in the field.
That's what I want.
Yeah. Do you ever see yourself getting your own med spa?
I'm thinking about it.
I was like,
everybody keeps coming to me. Everyone keeps coming to me, and they're like, "What are you waiting on?" You remember me? No, remember me. That's the goal. That's the goal. I have a lot of mentors around me saying, just do it. Like, you don't need to have X amount of years to perfect it. Just do it. And I'm just like, no. But that's my goal. It'll be awesome.
The fear of the unknown, but that's where we grow, right? Yeah. I'm glad you said mentors. A lot of, that's one thing I did pick up in nursing school. Well, not nursing school. I've always had mentors, but in my opinion, I see that a lot of females don't have mentors. And so I'm a grown man, I have 2 mentors and I love it. So I'm glad to hear you say you have mentorship.
I always have.
As a woman, and you always have. So that's awesome that you have that as well. Speaking of nursing school, I want to put your nursing school cap on for a minute. So back when you was in nursing school, because I graduate in 2 months,
Yay!
8 days, 10 hours,
Whoop,
6
whoop.
minutes. Yeah, December 8th, here we go.
Yes.
So first semester nursing school, when you first entered nursing school, was it what you thought it was going to be?
No.
All right, so what you thought it was going to be, what was it?
Well, I'm thinking like school, because I love school. Something like, oh yeah, this is just gonna be like my normal classes. I get to study, live my life. I was still trying to work at the CNA at the time. Unfortunately, had to let that go. They were so sad. But yeah, it was like a full time. I was exhausted. Like the first week. I mean, Monday through Friday, basically 9 to 5, and then we stuck in traffic trying to get home, stuck in traffic trying to get to school, and not sleeping, not eating right. Like,
that's tough balance.
it was, yeah.
That's the hardest part for me is
especially coming from like your background with competing and
our background. So we want to eat healthy and we want to work out. So like I've gotten better at 4th semester, gotten better. Like the first 2, it was a struggle. Like all right, but I'm tired.
Trying to juggle.
And we know the importance of sleep. But we really, I'm so backed up on sleep.
I know.
But so, so what made you stick through it? Because when you in a nursing school, I'm gonna tell people it's not for the weak. Like it's not. It doesn't mean you can't. You're stupid or anything. But it takes a certain mentality, and I think our background in fitness, that discipline, it transcends. It really does. Because man, I mean, I'm out there like that meme, looking out the window, like man, they out there having fun. I can't do nothing.
Right.
And it's sunny, but you see the goal at the end of the day. And I'm like, man, next year I'm gonna be out in these streets. Man.
And did and was.
Right.
Yes.
Oh, I see. I'm trying to be like that. But so that's good that you had that discipline. Because I've seen people drop out the first test.
Oh.
And it doesn't mean that they can't cut it. But when you go in, like I asked you that question, what did you expect? I didn't expect it to be that tough. I'm being real with you. And I was like, well, there is no plan B. Plan B is find another way to make plan A work.
That's right.
So I'm like, this is what it is. So what's some advice you would give to somebody who's thinking about it, like taking prerequisites right now as far as what to expect?
Yeah, so I would just say kind of prepare yourself to know that your life is not going to be what your life was before school. Don't try to force it. Don't try to make every event. Unfortunately, you're going to miss family events. You're going to miss friends events. Friends are going to get upset with you. Family are going to look at you sideways. But at the very end of the day, once you're done, if those people are still standing, then those are your true friends.
You said it.
Yes. I mean, I've had a couple of moments where I've fallen out with my girlfriends. Like, we miss you. They miss me. They're hurt because they don't see you, but they're still here to this day.
That's good. That's a true friend.
So don't feel pressure. It's hard. It's hard to not feel guilty to, not make that holiday event with your family, your friends, but
that happy hour.
You got to set boundaries.
You do.
Yes.
And if you ain't working, your wallet, like, hey, we
exactly. We're not going nowhere.
We're going to sit right here studying. So a lot of people don't talk about the external factors of nursing school. Like nursing school itself is hard. And so when you throw in friends, family, and relationships, and if, like you said, if you get to the end, you see who's standing with you. It's like, man, it has to go real dark for you to actually see who with you. That's what it is. It's wild. So encouragement, and just in nursing in general, I want to get into, like, we know have some shortages in nursing, right? So what's your thoughts on that? And do you see it alleviating anytime soon?
And it's crazy that we have a shortage in nursing. Like, looking outside in, people are like, wait, what? Like, there's all these travel nurses.
I guess people are leaving at a faster rate.
They are, because we're growing.
Baby boomers.
That too.
Right.
That's what it is too. And then also too, with teachers and professors, like baby boomers, they're leaving. So now it's a shortage in professors.
Right.
As well. So I think at some point it will get better. Yeah, I mean, and then it's crazy because there's like a wait list to get into nursing school. So it's just it's not adding up.
I heard that.
So,
it's a wait list.
Yeah, my only thing I could think of is that possibly, nurses are wanting to grow. So they're going back for their masters. They're going back for CRNA or nurse practitioner. And then we're just not filling the spots quick enough. Because now, these folks are going back to the NP school, being NP schools right out of nursing school. Whereas back then they would work the floor, maybe like 5-6 years, 12 years, then go back to NP school. Now they're like, no, straight through. Yeah.
I'm like, geez.
Yeah.
So you said you don't find yourself leaving staying where you're at pretty much, right?
Mm-hmm.
So what's next for your career besides maybe open up your own med
Yeah.
spa,
So currently I'm actually about to pick up another side gig. The medical director for my company teaches, it's called Injectable Academy. This is where you go in to get trained. This is where I got my training too.
Okay.
And she likes the nurse practitioners that work for the company to come in and actually train the students. So she reached out to me. And so I'll be picking that up soon. I'll be training
Professor.
students. I don't know about that. Instructor. So that, and then I have another girlfriend who's opening up her med spa. She reached out to me. She wants me to train her.
Of course she does.
And she wants to pull me on maybe part-time. And I'm like, I
She's
don't
a
know.
nurse also.
Yeah, she's a nurse.
Okay. Wow.
Yeah.
That's good stuff. And that's the beauty about nursing. Yeah, I'm every day I'm learning about, nurses do that. Nurses do that.
It's ever evolving.
And that's why, my background is in finance, and, that's why I kind of left. One of the reasons why I didn't want to spend the rest of my life in front of the computer. And there was only so many avenues I can go to make money or enjoy what I was doing. Being health and fitness, like, to me, everything health related, like, it's interesting to me.
Yeah.
And when it comes to finance, I'm like, all right, I lost that luster. I'm like, all right, I'm not making a difference for anybody but the company. No shade to anybody that's doing it, because at the end of the day, you have to find what's good for you.
Right.
Not, whoever is around you.
Right.
So that's why I went into that. So you have a friend that's going to open a med spa, man.
Yeah.
Trying to pull your talents.
Listen, I have a circle of friends. They are amazing. I have one girlfriend that opens her own, I guess you can say beauty bar, beauty salon, where she does like micro needling, brows. Basically, that's her specialty is brows. And she's about to open up another space, and she wants to get into med spa. She's actually reached out to me a couple years ago to come on and inject. So yeah, I've got all the right people around me. I have to just kind of commit to it and take the risks, like stop being so fearful of failing and just do it.
You do. I got to save your number, because you going places.
Yeah, you too.
I need to. Listen, I appreciate it. I'm trying to get, speaking of going places, I had my hardest nursing test like this week in class. Hardest since last year. It was in complex care.
Complex care.
Like all the shocks and sepsis and how to treat it and all that stuff. And I swear, like, going into nursing school, I will say this as well. Know what kind of student you are. Going into nursing school, I am a B+ student. I know this for a fact. I live around the 88s, 87s. I'm happy with that. I took this test. I swore, I was like, man, I hope I got a 60 on this. Hope I pass. And in my school, you need, over a 70. Under a 70 is failing. And I got an 87 on that test. I'm like, yo, that was hard.
Wow, congratulations.
Thank you. I'm like, man, I hope NCLEX. I'm saying for NCLEX. I'm trying to say for NCLEX.
Yeah.
Let me know if you want to take it for me, Let me know what's your price. I mean, just let you know.
It's not that bad.
I heard it's not that bad.
It's not that bad.
I like
it's
the
just
school.
knowing the game of the test. Like,
right.
That's it.
And
School's much harder.
Right. That's why I hear. I'm like, school that we use an ATI, which
we did too. I hated it.
Oh my
ATI
God.
is hard. The NCLEX is not like that.
I keep hearing that.
ATI is like, are you serious? NCLEX is like, it just flows. ATI, I just feel like
the same thing. I'm like, ATI can have.
I failed all those tests. I'm not gonna lie. When I took the ATI,
I'm so bad now. Ooh.
I stopped studying for them. I was just like starting a Christmas tree. I'm like, this is ridiculous. Like, that sounds terrible, but like
the Christmas tree.
I did.
Second semester, I got onto that game. Like, hold up, why am I studying so hard? Like, I'm trying to pass nursing school,
right?
Let alone ATI,
right?
And so I'm glad you said that. I feel a little better.
Yeah. But I mean, it's a good thing. I mean, it kind of makes you not get comfortable. Because if ATI was easy, you'd be like, I got this. And then when the NCLEX came, you probably wouldn't study. So yeah.
I'm trying to study. Man, listen, where can the people find you at? I'm obviously going to give your IG information, but you say for the people how they can find you.
Yeah, so my only platform is Instagram. So Dr. Shayla Weaver is my page. And again, I'm building it up. So you will see more posts, more resources on there. I talk a lot about fibroids. I also will start talking about aesthetic nursing as well.
Okay.
So it's a combination of both.
See more of the aesthetic side.
Yeah.
Those misconceptions, and from what I'm hearing from you,
especially from us.
What do you
our
mean?
Our community.
Oh, the misconceptions.
Our community. Yes, us as Black folks. Like, we are I've had my ladies come in. They're like not believing it. They're like, I don't know about this. That's for them. And so you have to re-educate them, kind of bring them back in, because other communities have been doing this for years and years.
You say not believing what now?
like Botox, like believing
doesn't
it.
work?
That, or it's not for us, like not for Black people.
Oh, really?
Yeah.
Well,
So
that's
just
why you got to
educating.
educate.
Yep.
I'm here for it. Listen, I'm here for it. Listen, I want to appreciate you for coming out. I know we had to push times back a little time, so I appreciate your patience.
I was going to come regardless.
See, that's why. Stick with it. Stick with it. Again, this is the Ivy League, where we celebrate some of healthcare's finest, Dr. Shayla. And till next time.